have to unmute myself. Hello! Greetings, everyone. Welcome. Nice to see all of your smiling or serious faces. It's all understood in this day and age we're living through. As always, as we gather together, if you have video, that's always something that adds something to our experience. But of course, if video isn't working where you are, or if you simply are not feeling up to it, that's also understood. We're glad to have you in any form and all forms. This indeed is Y4SD, Youth for Sustainability Dialogues, and many of you probably know these sessions for focusing on specific SDGs and the format you may know and have enjoyed over the weeks. Even most recently, we had a special storytelling edition. But all of that to the side, today is a very special edition of Y4SD. Special because we're focusing on what is going on in the world, and then very specifically in the region when we're thinking about India, Nepal, Bangladesh, Pakistan as well, the struggle with COVID and this wave of COVID that has impacted people's lives and just everything. So welcome to this special session. I'm, as the sign might say on your screen, Mark Fonseca Rendeiro. I work with MasterPeace, and I'm somehow based here in the Netherlands. And I'm very happy that together with the Connecting Dreams Foundation, MasterPeace, and Helping Hand International, we've put together a session today, not on SDGs necessarily, but on this issue of information. And I'm sure if I say it's a tricky time for information, I'll see many nodding heads. It's a challenge in the time that we live in, despite having access, perhaps, and of course even access is not universal, but to so much information about who we are, what we're going through, what is this, and when we start to talk about science, to be able to research, despite that fact, we still find ourselves with information that cancels out or seems more appealing. We find ourselves with even people who believe so strongly that they convince others of maybe facts that go counter to other facts. It's even facts these days are seemingly up for debate, or so it would seem. So I certainly want that to be part of the conversation today. I want to mention that during today's session, we're going to have our main speaker, who I'll introduce in a moment. But I also want to add that, first of all, your participation is, for me, a big part, I think for all of us, a big part of what we're doing here. So there will be opportunities, as always, in the chat. And some people say this and then never look at the chat. No, we look at the chat. If you have a question as we go, I will do my best, and with the help of the team, to incorporate that question into the discussion. I even welcome the occasional interruption, though I'll decide, I think, how many to take. But then after each speaker, if they have sparked something that you want to ask, we would like to hear it. And that could be a question, and I could also imagine towards the end, it could be an experience. If you want to share an experience, that's also what we're doing. I see so many familiar faces. Hello. So I also want to mention that later today, or later in this session, we'll be hearing from Kailash Kumar of MasterPeace Karachi in Pakistan. We'll also be hearing from Dhruv Panchal of Helping Hand International. We'll be hearing from Rahul Agrarai from God Gives Everything NGO, and Umama Khurshid of the project, and Vasu of Project Breathe of Connecting Dreams Foundation. They'll be coming, they're already here, but later in the session. But to begin with today, I wanted to start with, especially on the subject of information and learning from both experience and expertise in many ways, to introduce a professor of medical education, a member of the regional task force and crisis team of the Netherlands. She's also a member of the core team at MasterPeace, a friend of mine, possibly a friend of yours, Linda van den Burg-Witte. Hello, Linda. Oh, I brought my applause for you. Some people do it with a little graphic, right? Like, if you catch me occasionally making too many jokes at a very serious time, I understand your concern, so I want to acknowledge that. But Linda, it's very nice to have you with us. You have, since the beginning of this pandemic, which is now more than a year old, a unique experience. First of all, as we often say in conversations online and off, how are you?
Yeah, thank you, Mark. And yeah, I'm very happy and honored to be here. And thank you for the invite, for the invitation. And well, at this moment, I'm very happy because I'm always happy when I can yeah, share some knowledge, see new people and make new connections. So yeah, that's the reason why I'm very happy. So thank you very much all for having me
Yeah.
here in this
And
conversation.
it's a tricky thing. Thanks, and I'm glad to know that there is happiness possible, or there are these moments, right, that we can hang on to. And I think, though, we're focused on information today, and we're going to get into it. I think part of this coming together is also the possibility to connect with one another through a really difficult time, when maybe there are plenty of days where many of our friends gathered here today don't want to talk to others, or don't want to think about this virus that is all around them and that has caused such an impact. So it's a tricky subject, right? Happiness or joy or feeling in this time, anything but pain and concern. So we'll be navigating that today as well. I wanted to start, we bring you here today as someone with experience in the medical field and who's been observing what happens in hospitals in the Netherlands, but you're also a very international person. You have conversations with people in the rest of the world. Since the very beginning, I think you've been watching what's going on from a very unique position. If you look back at the year and now, yeah, over a year that we've had, I mean, what do you see unfolding when it comes to the coronavirus and how people are understanding it? How would you describe this last year?
Yeah, well, yeah, it's a very good question, and always, and also, yeah, thank you also for saying about happiness and joy, and in these difficult times, because we also need that. We always need something positive and a positive way of thinking. How bad times are, but well, but first, okay, my reflection on the last year. Yeah, well, what a year? I think, well, it's more than a year. It's already 15 months, and it
Yeah.
was a roller coaster, and it still is a roller coaster. And not only for me and for us, for all of us, I think, who's joining now. It's yeah, for the whole world, and now especially in India. When I see the newspapers, when I look to the news, it is awful at this moment, and that's also how it felt for me 15 months ago, and how it's still feeling for me. And it was and is not only a problem, a big challenge for us, for healthcare in the Netherlands, the hospital and region I work, but for the whole world. It was and still is, and we have to face this and to deal with this pandemic together. And well, about my reflection at the beginning, and still, yeah, we didn't knew what and how, and we're still searching for a lot about what and hows. And but looking back over these 15 months, we already know a lot more.
Mm.
And yeah, I'm a coordinator and teacher in medical education, and I'm sorry to say I'm not a vaccine expert, but I do a lot of research also, of course. And normally, me and my team, we train medical students how to become a good doctor. And information is the most important thing, and also to have the ability to reach out to those resources. And I think that, well, let's go back to 15 months ago, when I normally teach students how to become a doctor. I was asked in March to take place in a task force, and that was to think together with a lot more people about how can we help each other, how can we teach and train the medical staff, the nurses, the volunteers, the assistants, the students, etc. How can we work, or how should we work with this new disease? We were totally blank. And we had to learn a lot. And back then, at that time, we knew only a little bit about the course of the disease, the policies, the treatments, and we had not enough personal protective equipment either. So, and the personal protective equipment is also so important, but also not enough lung doctors, specialists in pulmonary diseases. We had not enough ICU nurses, intensivists, respirators, oxygen machines, etc. I think that's the same where you're also facing it at this time, at this moment, but also at the beginning, the knowledge about SARS-CoV-2, the virus, and the COVID disease, of course, and everybody had to be trained. And what was for me so important back then, and knowing this, I think the biggest learned lesson for me was togetherness, because together we can achieve more. We need each other. We need each other's knowledge. Sharing is caring. That's always what I say. Sharing the knowledge, sharing your experiences, the things we developed, but also share the biggest mistakes you make, because that's where we learn from. And what we did with togetherness, that was from a very small scale to a very big scale. And what do I mean with on a small scale? For example, I already referred to the students, the volunteers, the medical staff, the nurses, the specialists, etc. in our hospital. Do not work alone on this small scale. Do not stay on your own, not on your own island and specialism, but let's see how we can help each other. And that is what happened. And really working together began at that moment. We started to train everybody how to take good care of the COVID patients, from nurses to nutritional assistants, doctors who normally do nose operations, for example, and they all helped the nurses. There were no more boundaries, no more hierarchy. We were all the same, and we needed each other, because is also the biggest problem in the Netherlands. We do not have enough well-trained ICU nurses. And for the patient, what does she need, from examines to treatments to oxygen levels, medication? How many times a day do you have to turn the patient from back to belly, for example? That was all new for us, for all of us. I think you've all heard enough also about this in newspapers, etc. And we had to learn fast, and fast wasn't even fast enough. And we had also to train fast. And I think at the end, we trained with my team more than 1,000 employees, all from different backgrounds, to do one thing, helping the COVID patients. And in Holland itself, so a little bit bigger scale, in Holland itself, we started with fair sharing, for example. And what do I mean with fair sharing? The hospitals in the region, we share together the occupied beds, or, well, let's say the not occupied beds, for a good balance also in, let's say, the burden of care. And worldwide, also in Europe, in Italy, for example, because Italy was, well, let's say, it's not a headhunter, but that was more upfront of everything what happened when we compare it to the Netherlands at that time. And we shared our experiences and developed training and learning material, also in WhatsApp groups, for example. And it really felt when we're doing this together. And that's also what I want to share, what I want to say to you. We all have to prevent together that the medical system, the healthcare system collapse. I think Mark will come back to that later.
Yeah.
But also to prevent, to make unethical decisions. And for now, hopefully, also with this sharing with you, those experience and help from an educational vision point of view, I hope, I can contribute a little during this session.
Yeah, I think absolutely. I see a lot of nodding heads as we go, so that's always a good sign. I was thinking about what you were saying about cooperating, working together on a big scale, and cooperating even on the small scale, on the local scale. And that brings me back to this whole thing of, what do we know about the coronavirus? And now, in the era of vaccines, what do we know about the vaccines? Now, there is that cooperation on a large scale, including for information sharing and research, but there's also, and this is much harder to speak about because it's everywhere, the conversations that you have in your everyday life, in your family, in your neighborhood, and what kinds of information are being passed around and believed, because belief, strangely enough, in a talk of science, belief has this immense power that we see play out in different countries in the form of either people believing they know which solution or which path is the good one, and people believing quite the opposite, that the path that a government is choosing, or perhaps the World Health Organization is choosing, is not the right one, and so forth. So it's strange. I don't know if you have much to say on that subject, but I'm always fascinated how belief is very much now, I don't know if it's colliding with science, but
Mm.
there's a tug of war.
I totally agree. What do you believe? What do you want to believe? What's the easiest way to believe? Or do you prefer by finding the right resources to have it more evidence-based, for example? But I think that knowing about, okay, getting the virus, having the virus, well, when you do some research, well, you also need to know what does the virus do with you, but you need it from a reliable resource, of course. And but then after that, it's also still okay. What do you believe, and what's reliable news, and what's not reliable news at this moment? It's difficult. Where
Yeah.
can you find the real news?
Yeah. Let's get into some information. I know there are people here that have perhaps come with the desire to know more, or just to discuss a lot of principles. When you and I discussed doing this session today, you surprised me in a way, because you told me you wanted to start actually with the good news. And we don't always do that, right? In the media, in our conversations, because the bad is so in front of us, right? But it's an interesting style, and I like it. Starting with the good news when it comes to an individual's health and the coronavirus, getting it or not getting it. And then we're going to move after that to the vaccine itself. But let's start with that good news element.
Yeah. Yeah, it's well, after our conversation, to be honest, I was thinking about, okay, but first, starting with good news, we also need some basics. We need the fundament. We need a fundament about, okay, what is the coronavirus exactly? What is SARS-CoV-2? What is COVID? Um, um, and I think the good news is that there is a lot of information to find. And it's also what's also good news, that at this moment, because of research, because of everybody who's working against this virus, we already know a lot. And also about the vaccines, of course, we know so many things now about the vaccines, about what vaccines do, we at this moment we can give answers, to a lot of questions, and I
Hmm.
think that's maybe the best news I can
Yeah.
give you. But
Right.
maybe first going back, and I don't know, I think everybody knows, but maybe it's good to summarize a little bit about what does the coronavirus do with you before you get sick and you get really COVID, the disease, because we have to split the coronavirus, the SARS-CoV-2, and COVID-19, the disease. And well, sometimes it's bad luck. It is getting the virus, as far as I know from all the research I did, it's bad luck. When you get infected by the virus, it depends on what the viral load will be that you get from someone else, by when someone's coughing or sneezing, or and how does your body react on that? Who is getting sick? Who's getting, well, more or less a heavy course or a less course of the disease? Um, well, knowing that, well, you get problems, of course, with breathing. Everybody knows that. Lack of oxygen, accumulation of carbon dioxide in the lungs. And it depends on the virus, what does the virus with you? What does the virus with your immune system? Some of our immune systems works harder in a way of, well, like the erythrocytes. Well, some of us, they are very, very active in our body, and some are less active in your body. But well, maybe I'm going too far, too deep, but
No.
um,
So there's this element, Linda, if I may, there's this element of, what is the virus, which is important, and not everybody, unfortunately, has fully grasped. And there's still a lot of discussions, as you pointed out, required around that, just to understand these elements of how and why you get it. And it's interesting when you say, it's a matter of luck. Not to say you are a bad luck person in your life, but we understand that some things are not, if you do this, that equals you will get COVID. We see a lot of people doing the same things, but not everyone getting COVID. And then, people jump to conclusions as to why. But what you're pointing out is there's not an exact, when it comes to whether or not you get it or how you experience it, that's going to match in every case. We've seen it over and over. That's one of those cases of the good news is we know that.
Yeah, exactly. Exactly. That's right. Yes, yes. And also, I think some of the questions, or how do you say, more for example, I often get a question for, is there a living coronavirus in the vaccine, for example?
Yes.
And after all research, we can say, no, there's not. Well, for me, that's good news. And for example, also, does the vaccine affect your fertility, for example? Well, that thought has been helped out into the world, but I can honestly say, no, there's no reason to believe that we would trigger an autoimmune response against this and thereby to become sterile, for example. So, or is it possible that when you have a newborn and you're breastfeeding, that the virus will, or the vaccine will go into the mother milk, for example? And that's also good news because of all the research we have done, or not I, but the whole world, of course, has done. We
Sharing.
can honestly say, no, it will not pass. It will not pass and goes into the breast milk. So I think that's also good news. And also good news about DNA, RNA, and they say, okay, but an RNA vaccine, what mainly concerns the RNA and DNA vaccines, what happens? But also on that, I can also explain a lot, but let's go to the next slide, I think, Mark, because
It's
I
one of
get so
the,
enthusiastic to share my knowledge and to discuss about this. So yeah.
Yeah, no, let's talk about it with my tiny head in the corner. When it comes to the vaccine, right? We have these vaccines in the world. Many countries are producing them. They are finding their ways. Though I understand, I think only last week I spoke to our dear colleague in Sri Lanka who said it's nice to talk about vaccines. We have so little in supply that we can't even really consider it as an option right now. But if we look at, obviously, the United States, the UK, which led the way, India, which also has access to vaccines, there, of course, come with the discussion around the vaccines, right? What does it do? I mean, how does it work would probably be too complicated, I think, but you can correct me otherwise. Hold on, fixing myself here. But the question of what doesn't it do? Because so often people jump to conclusions, and you've just outlined several: fertility, the passing from a mother to a child through milk. Let's talk about just a few others, just to be sure. Many people will say after they've had the vaccine they feel ill. Talk about that for a moment, just to make sure we're clear on what that is.
Yeah, I think to explain it in the most easiest way is what a vaccine does is teach your body what the coronavirus looks like. That is, and most of the vaccines do that through a small piece of the coronavirus, and they show a very characteristic part of the jackets, and it's called the spike protein. And your immune system can then get to know that and can then build up your immune response against it. And when that happens, of course, you feel a little bit ill, or you get a little bit pain in your muscles, or maybe a little bit fever because your body is reacting on that. But that's also knowing about, okay, what does the virus do? And the virus is teaching your body how the coronavirus looks like, but it's not a living virus that you can get into yourself, for example. And when your immune system knows, okay, knows how to respond on that, then it will protect you later if you get infected by the real virus, for example. Yep. And yeah, there are also vaccines that do use viruses. I have to be honest in that, but then only a contained killed virus, not a living virus. And well, it works the same. But I think I saw
two stand by, Linda. I'm gonna zoom out and look at everyone. Actually, I'm getting a question from Priya, and I will come to it. Priya, you can, if you want to say it or type it, you tell me. You can unmute yourself.
Yeah, I'll type. Thank you, Mark. Actually, I wanted to ask one question. Since the vaccination drive is going on, once I am vaccinated, can I be a COVID carrier?
Yeah,
can you be a COVID carrier? Yeah.
Right. So one of the elements of the virus, this element that whether or not you're
will I be able to transmit it?
Thank you, Priya.
Yeah. So if I understand your question right, your question is if you are vaccinated, if after vaccination, if you can spread the virus, but not COVID. COVID is the disease. The coronavirus, too, that's the virus. But that's a very, very good question. And a lot of experts, and I'm more like, I more feel myself as one who's very experienced the last year than really the expert, but they're still doing a lot of research about that. And I think you can answer this question properly when 70% of everybody is vaccinated, because then you can really, okay, can you get it or not? Because it depends on, can you get the virus or not? So, and then when you by yourself get a virus, then you can also, transmit it. And they're still doing a lot of research about that. So I hope that we can answer this question in 3 months or so. So
it is one of those things, like often happens with the last year, that we're learning as we go in many ways, or gathering more data as we go. So that question is a very relevant one for everyone getting vaccines now and looking into what they can and cannot do. We see governments making different rules or trying to develop the rules on, if you get the vaccine, what can you do? I'm still zoomed out, seeing everybody. Hello. Question. And maybe we can make use, since some people aren't with camera, but if you're near your keyboard, you could just put your hand up. Has anyone had the vaccine? Who has had the vaccine? I don't think that's too personal to ask. If I had, I would raise my finger or hand. So Linda has raised hers. Yeah. Okay, so Kailash is raising his hand. So I see some virtual and real hands. I realize, of course, that depending on where you are in the world, that may not have happened. I didn't raise my hand. It has not come to my turn yet in the Netherlands. I'm waiting, let's say patiently, though every night I go, when? So I see also Simi has her hand up. So yeah, so we see that people are getting the vaccines, and perhaps that in itself is also a key way to, when it comes to information, right? You yourself, whether you're Simi, whether you're Kailash, you have a community with whom you can say, look, in this case, I have experience, and here's how it's going. But of course, yeah, it's this larger discussion of what the vaccine is. I don't know if you want to add anything to that, Linda. I'm still looking at the quashing the rumors of what the vaccine they say it does, which it doesn't do. Like, I want to make sure we cover that, and then I want to move towards, what does it do actually?
Yeah. Well, maybe it's also good to add something to the question. Priya, do I say your name right? Yeah, Priya had. Well, to start with, being vaccinated, that's very, very important to prevent getting the virus, of course. And maybe a 1% or 2%, hopefully, or maybe maybe 10%, but I don't hope more. They still can get the virus. Of course, also when there are mutants, for example, that the vaccination is not too protective for that. But I think in 90% of the cases, and 90% more, I hope, well, at the end, 99%, it will prevent. But that small part that will not prevent, then your viral load will be so low in your body, you won't get that sick from it then.
Right.
And when your viral load is also very low, then also the chance to transmit it is also lower. So you know what I mean? Also good news is,
Yeah.
okay, it's getting less. So hopefully that will explain a little bit more about, okay, why I would say, okay, well, take the vaccine, because yeah, that is our way out of this pandemic. But of
Yep.
course, you need the information, and you need to know enough to make the right decision. That's
Good.
also what I learn and what I teach medical students. Know your resources, and well, search a lot, so you have but good resources, and that you have enough information and the good information to make the right decisions.
Yeah, thank you, Linda. And we get in the chat a big question actually, and we can open this up to some of our guests in a minute or two. So thank you for being patient, everyone. There's the question of how do you describe how to make someone overcome vaccine hesitancy? And while you think about this question, I'll add, I'm a baseball fan, so the sport in the United States, but also in Korea and Japan. And I listen to baseball games on the radio, and you'll have now stars, famous people on the radio saying, hey, New York, I listen to the New York channel, the vaccines are available. They're safe. So here you have someone of some prominence saying they're safe. And they're free, which is also, further accessible. And so I realized when I started to hear this that, oh yeah, there's a need here. One possible way, it's not the only way, certainly, it's to try and get people to listen who would normally perhaps listen to an authority or someone of influence. Now, I'm not saying that's how we should live in this world, like only famous people should tell us what to do, but it's the idea of a leader or someone inspiring who urges you, or who maybe gets through to you. But anyway, I just think of my baseball story. Linda, the big question, how do you overcome vaccine hesitancy?
Yeah.
Maybe that's an old question, actually, in this world, even.
Yes, it is. Yeah. I think with the right information, with, yeah, let's say good marketing, and what you're saying with influencers, with good examples, people you trust, but also, well, have a good talk with your general practitioner, with your doctor. Yeah, I think that's the most important thing to do. But I'm not a person really who can, but only with stories, with the storytelling, with my experiences, and maybe also showing what happens when you don't do it, or what can, as an example, what happened, well, already months ago, of course, also in Brazil, for example, we saw without any rules, and without well, how do you say that,
there was no strategy.
there was no strategy to prevent. Yeah. Exactly. And without a strategy, yeah. And I think also being aware of the importance of a good strategy, but also the people who explain the strategy and tell the story behind it. But because of course there's always more than one truth.
Yeah. And there is that element of not only someone you trust, but also the unfamiliar, being afraid of what you've never experienced or what you don't know. And actually, in asking you all to raise your hands, I'm reminded of how it becomes less unknown when you actually know someone. Of course, Corona was the same way. When it was people in your life, in your family, in your community that were dying or otherwise sick, that's when it really came home. That's when it was really real for many people. And maybe the vaccine, to some extent, when it really is understood, is when it's closer to you and people have experience. Linda, I'm going to pause here with our conversation, but stay on, and by all means, there can be opportunities for us to all speak together. In the chat or in the video, you're all invited if you'd like to ask a question of Linda. If you're still formulating that question in your head, I'll gladly move on and just invite one of our participants today to speak on their experience. So I'll give it a second. Anyone that wants to chime in right away? I saw an almost hand, but then it disappeared. It was a reflex. No, I'll invite Kailash Kumar right now. Kailash, hello. It's so good to see you. Kailash Kumar is the head of MasterPeace Karachi in Pakistan. And Kailash, the first thing I remember when we first spoke, I guess in January of this year, was how busy you sounded with helping people in so many different ways. And now when we were talking about having a session about Corona, about the vaccine itself, but also the information challenges, I thought of you right away because you have so much experience with people. Instead of me telling my story of how I got to know you, I'd like to invite you, first of all, welcome, and tell us about your experience. I mean, it's also maybe a year now that you're working on the issue of Corona in your community. Hold it a little closer, see if it comes through. Oh, it's... No, again, we're having the slight difficulty. Kailash, let's do the same thing we did last time. Maybe unplug it, plug it back in. Classic. And I think then we'll have some luck. I don't just address Corona issues, I also address tech support. We're getting static, unfortunately. Oh, now you're coming through.
Can you hear me now?
Yeah.
So first of all, thank you very much, Mark, for giving me a time to speak with all the great fellows, especially with the professor. I can say the Professor Linda, because she is teaching many students in Netherlands, especially the medical students. So let me share my experiences during the COVID. As everybody knows that Pakistan is such a small country on the map, so we have altogether like 22 crore people in Pakistan, which comprises of 67% are the youth and 43% are the old people. It means that Pakistan is one of the country who has many youth here. So we have a very fresh blood here. So the first news break in Pakistan of the COVID-19, it was in March, 5th March 2020. So COVID teaches us a lot, because you see all the countries, not only the Pakistan, all the countries, they spend a lot of money for the preparation of the war.
We lost you again. Oh, what a pity. See if you can adjust the device or shake it a little bit. Just as you were making the great point, Kailash, of the amount of money and resources spent on preparing for war in a time where actually what we need is health. It's not coming back. You know what? Let's do it as we did last time. You won't be able to hear me, but you can speak freely. Unplug it, and then we will hear you. And I'll just signal to you when I need to interrupt.
Can you hear me right now?
Yes.
Yeah. So the last thing I said is that the people, all the countries, they have invested a lot of money for the preparation for the wars, not for the good universities, not for the good hospitals, not for the good education and all that. If you just compare all the country on the map, you can find out that there are hardly a few countries who spend a lot of money for building the universities and the hospitals. So this is one of the big questions for all of us. Secondly, as I am living in Pakistan, Pakistan is the country, everybody, if you know about it, we are known as Islamic Republic of Pakistan. So people here, they do not believe on all these things like the coronaviruses or any other disease, infectious disease. They just think that science are making a fool to them, and they are just asking them to not to do this and not to do that. Or very simple, they the first reaction came in my country is that the people are stopping us to go to the mosques, stopping us from the gurdwaras, stopping us from the temples and all that, stopping us from the church, because the thinking here is quite a big different from other part of the world. So this is the big challenge for us. And I myself has come from a medical family because both of my sons are doctor. They are in the final year of medicine. So, and I'm also very busy with my many medical teams to help the poor in Pakistan by providing them the cost-free medications and cost-free anything they would like. So the challenge we faced to realize the people that it's a dangerous virus. Nobody willing to wear a mask even. So by doing many conferences in churches, in temples and in masjid, but they hardly believe on all these things. So this is the big challenge. The other challenge, the paramedical staff is not ready for this big disease. This is also the very big challenge, as well as we do not have plenty of hospitals in my city, especially in Karachi. There are hardly 3 hospitals who caters the whole province of Pakistan, that is Sindh. So very few beds in the ICUs, very few supplies for the oxygen. So these are the big problems we faced a lot. But I always, when I'm giving my talk to the people, or when I'm attending any type of conference or something like that, I only say one thing: difficult time, trust God. So this is the only way. And the other thing, if you think positive, you will have a positive. This is the big point. It's nothing like that if you all the time talk about the negative. We do aware the people about the viruses, but positively. One of the question rises here in the chat box I saw, and even the Linda answered very well, that the people are very hesitant for taking the vaccines. The answer is very simple. When we are children, our parents take us to the hospitals for 6 different vaccines courses like measles, TB, and few polio and few others. So this is the simplest way to explain them. This is another type of vaccine which helps you to get rid of the virus. Then that they can realize, because when you're talking about the childhoods, so they do believe that yes, this is also the one of the vaccine, or this is also one of the remedy for COVID viruses. And secondly, the other thing, you know, that in Pakistan, about 6 months, people do not believe that how they get rid of all these things. But when they feel, or when they see the other country newses in different channels, then they realize that yes, there is something COVID, there is something virus in the world. So we try our level best to give them solutions. But you know, as a poor country or as an underdeveloped country, the people still here, they have a lack of money and the lack of hospitals and all these things. But thanks God, in Pakistan, if you just see the history, or if you just Google it, the Pakistani people and the Indian people, they are also the biggest philanthropists as well. they are not looking for anything from the different parts of the world. They do look, but most of the time, the rich people, they come out by themselves and spend a lot of money for all these things. So in 2020, we, especially in the poor and the less privileged areas, we have given like 6,000 families food for 3 months. And this is not, and it's a very big, it's a very big, so it's a very big help from the philanthropists from Pakistan to help the people, because everybody realized that this is the hard time. And I don't know why people talking about that this is the virus in Pakistan, this is the virus in India, this is the virus in Netherlands. This is not, this is, we are talking about the globe.
Yes. Yeah. Thank you.
By the globe. This is the people virus. This is the people virus. The people are infected by the virus. It's not like that India is infected by the virus or the Netherlands is infected by the virus. We never talk about like this. Whenever I discuss or whenever I talk, I say it's the problem of the people. It's not the problem of the countries.
Thank you, Kailash. I'll interrupt you there. Apologies, but it's such a good statement to hold on for a moment. To really think about that, and perhaps we've all experienced it in a different way. That this is not just a virus in one country, yours, theirs. It's very much ours, and we experience it together. Even if there are spikes in one place, spikes in another, who cannot relate to a spike in coronavirus? We've all experienced it over the year. But I want to hold it there for just a second, Kailash. First of all, in the chat, if you can, for anyone who wants to participate, there's a survey for the World Economic Forum on this very subject of, the battle against COVID-19. So by all means, the link is there. You can take the survey as you listen. Kailash, stand by for a moment, because we're going to hear from Dhruvs Panchal of Helping Hand International. Dhruv, are you with us? We'd very much like to hear your experience. There's Dhruv. You can unmute and please do share with us your experience when it comes to COVID.
Hello, Mark. Good evening. So, if I share this experience with you, so I will share as a one story that I feel. It's about the 2nd April, and me and my very close friend, you can say as my big brother or like that, the guy. We meet and we're planning to go somewhere some hilly station and like that, because so much boring here, so much tough here. So we just plan, let's go some outside and let's enjoy the vacations like that. It's around 2nd April, and on the 2nd April night, I got fever. So I got some idea that I was affected. Same with my friend, we both are affected on that 2nd April night. So the struggle starting from the 2nd April night, on the 3rd, 4th, 5th, I was recovering, but my friend is not so much recovering on that time. But on the 5th April, I realized when constant call got on my phone, Dhruv, we need a beds. It's in the morning, I got 6 to 7 call, and till in the late evening, I got around 50 to 60 call. So I just, talk with my sister, she's a doctor, and she tell, situation is not good, hospital is going to full. So on the 6th morning, I got realized that the situation in India is going to worse. It's not before the 1st April. It's not about the March. The situation is going to worse. So many calls, we got, because my number is in public domain with my friends, and as our organization working here in Gujarat and many countries also. So suddenly, we immediately make one task force. We divide the work. We just divide, committee make a plasma committee for emergency medical store, milk COVID patient, RT-PCR, hospital beds, tiffin service, home caretaker and telephonic consultation, that we make the committee for that. And I contacted some influencer in my city. I have very good friends in in Gujarat in movie who are working as actors, some influencer as a model, very good friends I have here. So we make one WhatsApp group about 25 people for the first discussion on the 7th April on that day. After we make a poster, release the poster on the public domain in the social media all over the world, so people have our number. And the struggle is start, I got a call from the people we not have bed. So we are starting to find the bed from that. After I got a call, we not have oxygen. So we are struggling for the finding oxygen. Third call I got, from the same person, we not have oxygen, we not have injections. So we are trying to find injection, and injection is only find on the black market. So we are struggling to give them injections by our contacts. It's just like give money and we are trying to give you the injections. Our team is not just only online. We are work on the ground, on the car. We are traveling and help. I'm that time little bit I'm COVID infected on that time, but there is no option for me to be at home, because I know that people are need for me, and if I will not do, it's just injustice with me and my people, my surrounded the people. So the first struggling is ICU bed. Here no ICU bed. Every time when I call the doctor, I call the hospital, they are say zero ICU bed. So our team, like from late night 3 a.m., 4 a.m., 5 p.m. I got a call at night 2 a.m., 3 a.m. We are struggling for finding one ICU bed. I requested the doctor. We requested to doctor to give one bed. The girl is 23-year-old. The boy is just married. Please give them the ICU bed. We are struggling these all things, and at the last, like we are struggling for the crematorium, like as a last thing that we struggle for the people. There is you have to take a token in this crematorium. There is no place on about 15th April. I'm talking about 14th April. The situation is that you have use your connection to get the token from that. You are start struggling from the finding bed, and you are ending from the finding the place in crematorium. In this between the situation, I'm talking about one of my friend as a starting that we are planning to go like to hill station and like that, because he's my partner in my business. As you said, like he's as a part of this organization, he acquired 80% of my life space, and I lost him on a 19th April. And I was on just in hospital, and we are struggling. The guy is just 27-year-old, just married with her girlfriend just before 1 year, and with lots of dream, lots of the thing they want to do for the people, for a family, and we lost him. It's only the one not person. I lost thousands of people surrounded me every day. Got a call. Sometime I call some people, I find the bed, I find the ICU, and I got the return. He's no more. She is not more. If the age is around more than 60, more than 50, then it's been okay. But the person is around 30, 20, about the 40. The children, when I just what's experience I got from two experience, after I want to end my speech. First, about my friend. Actually, there is one problem about getting injection. That's totally issue about the injection. I struggle a lot. Whole the night I travel to find the injection. After I got the injection, I give the injection to doctor, and we just hope on this ground of hospital that my friend will recover. And at around, I think it's around 12, and I got message, he's no more. A second thing that I happened, like there is one when woman, she's a divorcee, and she lives with her two children, and her I think 12-year-old baby called us for the help to find the bed, and like that we're trying a lot. We're finding these things, and after 3 days, I think 4 days, I called on this number, like everything is okay, anything you need, and I got cried voice from her children, like mom is no more. So these situations, totally break us, totally the feel, like we lost everything in just some moments, some 20, 25 days. And as a I don't have what to conclude it, but this scenario of last 25 days that every Indian, I think, face, every home in India lost every one person. And that's
Dhruv, thank you so much and for sharing. I mean, it's not easy. It's not easy to talk about, and you did it, and I appreciate it. And I think everybody feels to some extent the pain you're going through, and it touches pain that we've all suffered as well, and you're still suffering. I understand, Dhruv, that there's a video related to your work. I'll invite the CDF team to play it, and I'll just be quiet.
Yes, Mark.
But thank you, Dhruv. Thank you for the video, and there's that element, of course, of putting names, faces, images to what is often statistics, right, and numbers, and I think that's a big part of understanding what's happening, understanding the virus, and understanding things that both Dhruv and I mean Linda has also brought that out, and Kailash, regarding that this is everyone is going through this at the same time, regardless of where you live. It's all of us. We're a little bit into the end of the hour, but I would invite you all to stick with us on this special occasion as we share a little bit more. And I'd like to invite Advocate Rahul Agrare to join in the conversation. If you can unmute yourself, and by all means, from the organization God Gives Everything NGO. 1 or 2 minutes, by all means, feel welcome. Tell your story. Oh, there you are. I see you smiling, or your picture smiling. You can, yeah, there you go. I see it unmuted, Rahul.
Yeah. Hello, everyone. Yeah, this side Rahul from God Gives Everything. Is this audible?
Absolutely, Rahul. Tell us your your story.
I'm Rahul Agrari. Actually, I'm not that person who is actually helping to the people. It's a short period about this session, so I'm connecting here. But whatever I do have, I will share you. I'm in legal and administrative department. Okay. So our team, God Gives Everything, is helping the poor, like food donation drive, oxygen cylinders, providing oxygen and cylinders, right? We are connecting to the people over the WhatsApp group and all, and we are sharing the details over the status of over the WhatsApp, and whenever we get the call from the helping people, we go there and provide the food donations, and whenever we get the call regarding the oxygens, we provide them, and the team who the person who has overall helping to the people is that Mr. Ashish Gupta, who is the founder of the God Gives Everything, who is not able to connect here. That's why I'm here. Okay. I guess I don't have as much details to provide you. So I hope we will cope up this pandemic as soon as possible. Okay.
Yeah, thank you so much, Rahul, and certainly the organization God Gives Everything NGO, and you remind me in what you're saying, and the way the inequality in the world is exposed, of course, in such times, because where we can talk about certainly the vaccine, we can talk about the illness, but there's this element of the other aspects of life in places in the world where people, the virus is one problem that risks or it threatens their life, but also the loss of income, the loss of food when it comes down to it. But what's amazing to me is how people do come together and do help one another. I was listening to a radio program talking about the struggle in India and the question, like, why hasn't aid traveled around the country? And there are things happening in high court and government circles, or not happening, but there's amazingly people organize when there is this gap, or where there is a lack, people step in and organize themselves. Of course, we would all appreciate it if a government that we are a part of as citizens would also help that process. But it's always impressive, and I know CDF, MasterPeace, I mean, altogether, we find ways to make things happen, whether or not our governments are in good shape or doing things correctly. So I'm always very inspired by that, because we know what is needed and who needs it. We know the people. Okay, my last invitation, and thanks again, Rahul, for today is Umama Khurshid and Vasu on Project Breathe of Connecting Dreams Foundation. Come on in. I would dare to say inspire us, but I'm happy with just hearing what you're doing. I think the inspiration will come.
Yes, Mama will initiate the conversation.
Okay, so hi everyone, I'm Umama from CDF Jamia Millia Islamia chapter, and I'm the president currently over there. So I would like to say that big change comes from hundreds of tiny steps, and all of them do matter. So as of today, India is, as we all know, undergoing a severe second wave with the world's highest daily cases, and hospitals and healthcare providers are running short of resources in fighting COVID-19 situation. And the actual ground scenario is very much critical. So oxygen is critically required to treat patients affected with COVID, and many of them require hospitalization due to fluctuating oxygen levels. However, there's severe shortage of oxygen availability across hospitals in India. So we came up with this small initiative to do the little we can to make the difference and to become the change makers. So 5 of the organizations came together in this initiative. So we help we help people in India who are in urgent need of oxygen cylinders. So we are Help and Feed India Association, United for Humanity, Aghaze Talim, CDF JMI, and Okhla Readers. So Help and Feed India Association is serving in Kanpur, and we also have Ria Kocher today with us from Help and Feed from Kanpur itself. So rest Vasu will tell what Project Breathe is exactly.
Yeah.
So yeah, thank you, Mama. Hi everyone, I'm from ARSD College. So as rightly mentioned by Mama regarding Project Breathe, which was started in which we are collecting and raising funds to purchase portable oxygen cylinders, which we call canes, and then moreover it will be distributed to the needy ones with free of cost. So there will be no any charges since we have been raising funds for the same. So currently it's not more about the achievements or something which we have achieved over the period of time, but rather it's the help we counted. So we have distributed around 100 plus portable oxygen canes as of now across two states of India, Kanpur, Uttar Pradesh, and New Delhi. So it's been forecasted that India will soon be hit by the third wave of COVID-19. It's already been so much negativity out here. So let's not just hope for the same. So we will be requiring funds for the same to carry our projects. And now talking about the verification and the leads which we have been doing. So as rightly mentioned by Dhruv, that he have been working 24/7, whether it's for injection and whether for arranging oxygen beds or maybe talking to the hospitals for some critical patients. So CDF has initiated this COVID task force in which from requests which we have been receiving over our social media handles or through the forms which we have initiated, and to get that particular person helped by providing particular appropriate resources, whether it's beds or whether it's oxygen resources. And then in the initial days, we faced these challenges of somewhat mismanagement because many of the resources were not being arranged. But then through a systemic model through which we will be accepting various requests through forms, and then our team will contact the patient's relatives or maybe patient's attendant, and then we will directly help them within a very short span of time. We will try to keep this process as much as fast so that we can help more and more people in a day. Vaccination is something which we all hope for. As I mentioned, the question of vaccine hesitancy, we will try to create more and more awareness within rural India, parts of rural India where people are still being uh, maybe hesitate of taking vaccine, whether it's safe or not. So vaccine awareness is something which we really look forward. So I think this is it. We know the whole world is with us, and we really look forward to help in each and every way because we are in this together at the end. So yes, over to you, Mark. Thank you.
Oh, thank you, Vasu. Thanks so much, and for sharing and for all the hard work. Yeah. I want to invite here as we approach the end of our session, but there had been a question from the audience under the pseudonym of iPhone.
Yeah, I hope I'm audible. Actually, I couldn't change my name. Hello, ma'am. Hello, Lina, ma'am. So my question was that there have been a lot of variants of viruses in India.
Hmm.
At least there are 16 or so variants, and we are grappling with the second wave right now. And the Indian government also said that there might be a third wave, and it might be a little more severe. And we also observed that the second wave was a little more disastrous in a lot of countries around the world. So I wanted to ask that is there any difference in vaccination, in the efficiency of the vaccination, if there is a different variant of a virus that is traveling around at that moment? And also, I will add on to this question that what is the duration of immunity that a virus can provide us?
Yeah, thank you. Thank you. What was your name,
Thank
actually?
you. Suyesh.
Switch. Okay,
Yeah.
not iPhone. That's family name.
Yeah.
So Linda, the question is a great one, and I blame myself for not thinking of it, but that's why we have friends. The first question is this element of, so we have a vaccine, but we also have the variants that continue to emerge, and how will the vaccine be, or what do we know in terms of the effectiveness, even as there are, I think we say mutations, but you can correct me in a second. And the second part of that question was, nope, it slipped my mind now. Help.
The duration of the immunity that a vaccination will provide.
Yes,
Yeah.
this is what I'm saying, the power of the crowd. The duration of that, once we get a vaccination, how, as far as we know, how long, and this is going back to that learning as we go thing. Go ahead, Linda.
Yeah, well, a very, very good question. What I read this morning, and that was from a researcher in the UK, and he gave quite good news because first they said, well, it was also with the UK mutants. They didn't knew, okay, this UK mutant, and then there also came the South Africa mutant. Well, how will the vaccine respond on that? And well, thank God, it works. They found out it works, and in the case of the Indian mutant, they compared it with the UK mutant, and they're quite similar. Also, the way they behave, the way they with the rapid they go, how fast they go, and well, of course, they still have to do a lot of research about it, but let's be honest. It's only 1 year ago that that they started to to develop the vaccine. So yeah, well, in my opinion, it was already really the surprise of 2020 that it did happen, that we got the vaccine. So well, I have a good hope for that also the mutants, but we have to see that. We have to see, we need to do more research. We need more information, more people. We can do research with. So, but my first feeling, my first impression, and also what I read in this morning, it was really this morning in the newspaper and also in one of the medical magazines, was that they compared it and that it was good news that the vaccine would also have a good reaction on that and protection for that mutant.
Yeah.
And what about the time? Well, I'm so sorry that I cannot answer all the questions perfectly, because also in that case about how long will you be protected, that I think let's summarize it so that also that's not really known at this moment. They think, well, they know at least 6 months, and I already see your, well, only 6 months. No, but they're only working now with the vaccines for 6 months. They think, well, more or less a year. It's also like the flu. That's also, most of the time it stays in one season. So hopefully at the end, we will see that, well, once a year, we need a revaccine. And that is what I think, but well, that's my opinion. So that's not evidence-based, only based on my own personal research.
But I find it also interesting and possibly encouraging is that, you know, what we learn now, because we, as we said in the beginning of the session, we should also as a world be learning from our mistakes, wherever those mistakes are being made. And in some ways, if we get to the point where we learn as we go that the vaccine is no longer effective after, let's say, 2 years, 3 years, whatever it is, but that we will have learned now how to, for example, get vaccines out at such a rate, how to be better overall with healthcare, I would argue. So I'm thinking back to that element of learning and making use of this knowledge so that when we need it again, we will have it instead of being lost and confused and not prepared. But that's just my take on it.
Yeah, maybe I can add something also about the vaccines. The vaccines are very, very quickly developed, and within a year. And that has never happened, that they developed a vaccine within a year. So I think you may ask yourself, how is that possible? And I also think that that's really the point of trust, of why people have fear of the vaccine. Is it safe, and whether they work, or you cannot ignore that. But also it's important to know about what happened with the development. And I think maybe if I have 2 more minutes, I can a little bit explain more about the development of the vaccines. And what did they do? And first, all the knowledge and skills were already used. For example, about previous outbreaks with SARS-CoV-1 and MERS, you can compare the virus also with that. And because of all the research they did, I think already for 18 years or so, and they used that all in developing this vaccine. So knowledge, skills, the previous outbreaks, the knowledge from that. And secondly, also very good agreements that we already had were used. So the agreements, for example, how can I explain best? Normally, after research, you have a review of the research, and it goes like in a certain way. And well, what they did, they were able to do the research together already with the reviewers, and those reviewers, they had already looked over the shoulders of the studies. So also with that, they gained a lot of time. And third, all the phases of the research that had to be completed, they were placed also very quickly and efficiently. So whatever would not happen in a normal situation. And also that saved a lot of time. And I think also the incredible amount of money that has been raised by governments, by international, bodies, how do you say that? I always struggle with that word, philanthropy. Yeah, philanthropists.
Absolutely.
Yeah, to make all this possible and to start producing vaccines. Well, we did not know yet whether they would work or not. So, and all of that has made it happen. And that what we have. Yeah, and that all together, those 4 things, I think, well, that is why the world could develop COVID-19 vaccines within a year. And really, and also with my trust, without compromising in safety or efficacy.
Yeah.
So, yeah. I
Thank you,
think
Linda.
that's, and maybe that's also important sharing that.
Yeah, it's in a way understanding that actually we, despite all the struggle and the difficulty, that we've arrived at a very, well, we've learned a lot, and we can use that knowledge to move faster when we need to. Anyway, Linda, I want to say thank you so much. Thank you also to Umama. Thank you to Rahul, Dhruv, Kailash, everyone who's brought in a question, everyone who's nodded along, whether it's with a camera or without a camera, and you were still nodding. I felt it. I think many of us felt it. I want to say a big thank you also on behalf of the team. I want to mention, of course, the Y4SD team is Art Boss, Amit Tuteja, Dr. Sapna Narula, Simi Mishra, Ashimi Muthur, Arshvir Kar, Priya, and Dhruv, and Valentine, and Vasu, and Vibhav. Have all helped putting this session together, and I hope it was interesting and it helps you in some small or large way. I'm wishing you, I think we all are, wishing you strength, courage, and all the best during this very difficult time. And hopefully we all meet again together in such an environment, maybe even in better times. So until next time, I say thank you very much. And the audience is going to applaud. All right, all the best. Take care.
Thank you, Mark.
Thank you, Linda.
Shall we stay for a moment?
Sure. I need a bigger audience to clap.
No.